Well, good morning, everybody, and thank you very much for attending. So, first of all, thank you for Eric for putting together this great meeting, and also I'd like to thank Paul Brazis, who had put this meeting together and run it for years. So, thank you. So, for this section, I've been asked to do retina cases, and I've selected 6 cases, each of which either has a neurologic component or something in the orbit to try to keep the interest and keep it relevant to this group. And I've also selected a rainbow or a variety of cases that sort of range from horses to zebras. So the first case we're going to start with, and let me see here. Oh, there we go. So the first case is going to be directed at the front row. Anybody who wants to chime in, otherwise the front row. So this is a zebra. This is the case of the bilateral...
Wegener's.
Huh?
GPA.
GPA, yeah, exactly. Thank you, Andy. Great poker player, Andy. Bilateral cherry red spots. So this patient comes in and presents like this, 24-year-old. Just throw out questions. Anybody have an idea what they think the visual acuity is here? Good-looking discs, good-looking vessels. Look at the maculas. This is not an acute process. Anybody want to guess the vision? 20/20. Okay. We'll get there. So Neil says 20/20. What condition do we usually associate with cherry red spots? CRAO, right? So here is side to side. Here you have this patient on the left with our cherry red spot, and you have a patient with a CRAO on the right. You can see some similarities, namely the cherry red spot, the whitish macula, but you can see the differences. Look at the vascular caliber. The caliber of on the right, where you have the significant arteriolar narrowing. You have changes and even hemorrhages around the disc, and you have emboli in the arteriole, so clearly significant differences. Here is a ultra-wide field red-free, and you can see that most of the pathology here seems to be limited to the macula. It doesn't really extend much beyond that, at least on the ultra-wide field. So here is a little bit more on the history. So this is a 24-year-old male. He referred to neurology for strange motor jerks, difficulty walking. 6 to 7 year history of progressive jerking, difficulty walking and standing. Previous workup included a diagnosis of a seizure disorder, and he was treated with anti-seizure medications. He was a high school graduate, and he had been previously employed up to a couple of years prior to this. So his past medical history is positive for asthma, ulcerative colitis. Just to go back and give you a little bit more information, here are OCTs on this patient on the left. And you can see that most